Good afternoon. It's a pleasure to be able to give this presentation to everybody here in South Korea via internet and tape recording. And today I'm going to talk about what we know about desistance from crime, findings from the Pathways to Desistance study. The desistance study is a large-scale project that is a function of serious adolescent juvenile offenders that we tracked in two cities in the United States, Philadelphia and Phoenix. These individuals were 16-year-olds on average at the time of enrollment into the study. The majority of them were males. They had 2 prior court appearances, and it was ethnically diverse sample comprised of a good proportion of African Americans and Latino individuals. This study was part of a larger project that was funded by the MacArthur Research Network on Adolescent Development and Juvenile Justice that I was a member of, that started in the late 1990s and was a 12-year project that MacArthur funded, and one of these projects that they funded was a study that is the Pathways to Desistance study that I'm talking about today. Originally it was developed in 1997. It was a group of researchers and practitioners that got together literally in a U.S. Airways club in the Philadelphia airport to develop a research agenda to inform and improve juvenile justice processes in the United States. We focused on issues related to competence and culpability of juvenile offenders, the risk factors of offending, and the extent to which there was amenability in desistance. In other words, can these individuals change from a life of crime on a path towards desistance? This project was supported by a lot of individuals, both private and government associations, including the Office of Juvenile Justice and Delinquency Prevention, the National Institute of Justice, the MacArthur Foundation, the William T. Grant Foundation, the Arizona Governor's Justice Commission, and so forth. Without this support, we would not be able to undertake the study that we have done and reported on here today. Our working group was comprised of a series of high-level scholars from sociology, criminology, psychology, as well as the legal realm, and that's the list of individuals who were part of the large research project, which was led by Ed Mulvey, who is a psychiatrist at the University of Pittsburgh Medical Center. Why did we engage in this study in the first place? We wanted richer information about serious adolescent offenders. A lot of what we know in criminology about why people start offending, why they continue offending, and why some people stop offending is comprised or is learned from a series of studies that have focused on general population samples and largely males. We don't have a lot of information on a real serious deep-end population of offenders that's policy relevant. We also wanted to look at why people desist from crime. We track these individuals when they're in mid-adolescence and we follow them through early adulthood. So we're trying to understand issues related to individual maturation, life changes, as well as involvement in the juvenile justice and adult criminal system. We think that the information gleaned from our project will be important for people who work in juvenile justice with respect to risk assessments as well as targeted interventions and sanctions. The study design involved 2 sites, Philadelphia and Phoenix, and we chose those 2 cities for 2 reasons. One, they are ethnically and racially diverse. And second of all, to be quite honest, they had very good working systems that we were able to use, and they were willing partners with our research team. We enrolled 1,354 serious adolescent offenders. So these are individuals who committed serious felonies, so robbery, aggravated assault, rape, those kinds of offenses. At baseline, they were ages 14 to 18. We also included a sizable number of females as well as people who were transferred to the adult system. We interviewed these individuals regularly over a span of 8 years. Initial interviews were at the baseline of enrollment study, and then for the first 3 years, we interviewed them every 6 months. And then after the first 3 years, beginning year 4, we interviewed them annually. We gave a lot of different kinds of instruments to these kids. As you can imagine, when you put 10 to 15 researchers in a room, everybody wants their particular scale and sets of measures they want to collect. So we have information on family context, relationships, life changes, and when they were released from the institutions, we also then followed them in the community and to all the states and nations that they moved to after their original input into the study. So now you can see why we needed a lot of research support to track these individuals over time. We were one of the first studies as well to collect information not only from the child, him or herself, as well as a parent and a collateral, but we were also able to secure data from official sources. Namely, the FBI was able to provide us with arrest records for these individuals. So the nature and scope of this study to have self-report information from multiple individuals, as well as official records from the National Office of the FBI, it's one of the only kind of studies that's ever been done with this level of detail in the United States. We look at a lot of different characteristics, as you can see on there. I'm not going to read all of the variables that we collected, but we had information on background characteristics, psychological mediators, life changes, community context, personal relationships, family context. Imagine what you were like when you were 16, 18 years old, things you were doing, places you were staying, people you were dating, all of these kinds of things we collected information on every 6 months for the first 3 years, and then annually thereafter up until the end of the study at the end of 7 full years. So we have a lot of information on these kids, more information than any kind of study of this nature has ever collected. As I said earlier, these kids are 16-year-olds on average. It's an ethnically diverse sample. This just gives you a couple instances of what they came to the table with, in other words. So for example, at baseline, these individuals had high rates of alcohol and drug use. And so you can see that males and females were comparable with respect to some sort of substance use diagnosis. So these kids are using a variety of different kinds of substances, whether that's drugs and or alcohol, and more often than not, they're using both of them. Mental health disorders are also very common for these individuals, primarily with respect to ADHD and high anxiety, which is not atypical for individual adolescents in the United States during the same time frame. The most serious charge of the kids that we got at the baseline interview was for a felonious assault with a gun. As you know, in the United States, you can have a gun assault charge that can be a misdemeanor. It can also be a felony. We were interested in the very serious, deep-end kids. So these are the kids who are committing various serious crimes, not the kids who are stealing a candy bar from a drugstore or something like that. These are real serious offenders, and they're still only, on average, 16 years old. This is just a map that we created in the city of Philadelphia, which is also the site of my first academic job at Temple University in 1996. The city of Philadelphia is kind of like a little bit of a straight line and then tilts to the right to the northeast part of Philadelphia. And basically what you want to see from this is the red areas are low-income residents, low SES, and those little dots represent known drug markets. And what the purpose of this is trying to show you is that a lot of the kids come from areas that are socioeconomically disadvantaged, that have a lot of drug markets in them. So they're coming from really disadvantaged and crime-prone neighborhoods. We finished the field interviews in 2010. It's an average of 90% were completed at each time point. And this is no small matter. To follow serious adolescent offenders who are transient, who don't stay home with two parents for any given period of time at this level, who are serious adolescent offenders, we were completing interviews at almost total completion. And the way we were able to do that is we had generous support from both the private foundation and the government sources to employ an army of postdoc researchers and staff who are absolutely committed to helping us carry out the interviews and to track these kids all over the country. So imagine a kid in the Philadelphia site. The kid could go to New York, he could be in New Jersey, she could be in Delaware, she could be in Maryland in a matter of 20 minutes or 2 hours. And so we had an army of people who were very dead set on ensuring that we were able to track these kids, which is a very difficult thing to do. We completed over 21,000 interviews, so that's a lot. We've disseminated our research into over 100 academic articles in academic journals. We've also engaged in over 100 presentations to public officials and service providers. One of the things that we cared very strongly about at the outset of the study was that, yeah, as academics, we wanted to put our work in academic outlets, but we also care very deeply about engaging the public and the policymakers with respect to our research. So we talked to defense attorneys, we talked to community groups, we talked to justice officials, basically anybody who wanted to listen to our story about what we learned from this study. We talked to those individuals, and that was really important for us to engage the practitioner community, the public community, as well as those individuals in policymaking. As well, we also archived our data set for the public to use and for academics to use, and we have recently learned that it's been one of the most downloaded data sets in the history of ICPSR, and I think the majority of my PhD students who work under me are using these data for their dissertation. So that's always nice to see, and they answer really important questions that we never thought of 10 years ago. So it's a great resource for people, and so we're very thankful to be able to have done this. We've explored a lot of different issues within the data set. We've looked at, for example, how effective substance use treatment is. We look at issues related to acculturation. So we have a lot of Hispanics, Latinos who are in the study. A lot of them were not born in the United States, and so they came to the United States from Puerto Rico or Mexico or other countries. And one of the things that we know in the immigration literature is that when individuals come to the United States, they have to assimilate and acculture themselves to the morals and ways of the United States, which is not easy for a lot of individuals to do. We also look at issues related to procedural justice, how kids feel that they were treated by the police and the court system. We created this really nice website, or actually I didn't create it, a team of people created it, but it's really nice, it's still active, and it explains all of the measures that we use, all of the way the variables were coded, and it's a really good repository to what the study is about. And then I talked a little bit earlier about the archive that we uploaded our data set that's available now for people to download. And we're very proud that we were able to do that, because a lot of people don't do this with their research. So what I want to spend the majority of the rest of today talking about is just give you a snapshot of, so what did we learn about these kids after we tracked them for 7 and so years? Sadly, 45 of these kids died. So 45 kids out of 1,300. That's a very high death rate considering these kids are in their early 20s. And the majority of them died from homicides and assaults. Few of them died from self-harm, then motor vehicle theft, and 3 kids died from falling. And the red charts are for Pennsylvania, and the blue charts are for Arizona. That's not to say that there's any reason why one was more or less in cause of death in one place more than another. But the idea is just we wanted to break it down by site so you all can see the differences there. But at the end of the day, 45 kids unfortunately died. In a study that I led a few years ago, we looked at what are the predictors of dying early in our study, and we looked at this in terms of distal and proximal. And let me explain very briefly what distal means. Distal are the things that are basically things that the kid came to the table with at the baseline of the study. So what we found was African American kids were more likely to die early, as well as kids who presented with a substance use disorder at the baseline interview. Proximal causes are things that we tracked over time in the study, and then right prior to the death of the kid, what factors were he or she involved in. What we found was kids who carried guns, kids who were in a gang, and kids who were using alcohol and drugs were more likely than individuals who are not using those substances or not gang members or not carrying guns to be more likely to die. And so what we take from that basically is that these kids are living a lifestyle. And that lifestyle has gangs, it has guns, it's got alcohol and drugs, and you put all that stuff into a pot, you mix it up, and it just creates an inordinate amount of risk for these kids of dying early, and that's what we found in our study. We also looked at something related to status changes, and so what I want you to look at here is, this seems a little complicated, but it's real quick, easy to understand when you look at this in detail. You want to focus at the blue chart, the blue bars in there, and what you see is the blue bar is the percentage of the sample who over 7 years experienced any of those things on the horizontal axis. So if we go to the far right-hand side, you will see, or my far right-hand side, your far right-hand side, about 70% of the sample experienced at least one romantic relationship over the course of the study. And if you look at the, in the middle, third one over, parent now, by the end of the study, almost half of the sample by their early 20s was already a parent. Just give you a sense of what these kids are doing over the course of 7 years. We also looked at education attainment by age. Now remember, the mean age at the baseline of the study was 16, so some kids are a little bit younger, some kids are a little bit older, and so we basically standardized this graph by age. And what you see is that over time, about 61% of the sample does have a high school and GED. That's not very high considering what the normal rates are for the general population who are not serious adolescent offenders. But what I think is a useful thing to learn from this graph is that these kids are still getting educated. So even though they have a lot of risk, even though they are serious violent offenders, they are still finding time to get educated. About 15% of the sample has received some sort of vocational certification by the end of the study. So I think what's really helpful here is that these kids can change and they can get some things that might benefit them over the course of their lives. A lot of them are parents. So as you can see there, by the early 20s, the males in the study are represented by the red bar. The females in the study are represented by the blue bar. About 7 out of every 10 girls in the study was already a parent by the age of 23, which is, when you look at birth rates in the United States, these are on the young side of birth rates in the United States compared to what we know from the general population right now in the US. So these kids are becoming parents much earlier in the life course than individuals who are not in this study, for example. If we were to look at parenthood by age, you can see right there what we're looking at here is this is the percent at each age reporting that they have at least one child. And so kids are having at least one child at age 20. Almost half of the sample has already at least one kid. They could have multiple kids. So not only are they getting having kids in general at a higher level than the US population, they're also having them at an earlier age than those individuals in the general population. And so that's something to be alerted to. We also were really interested in whether or not these kids were getting money doing illegal work. And so we asked questions about, when you earn money, how much of it is legal and how much of it is illegal. And you can imagine illegal work would be, selling drugs and those kinds of things. The blue graph, which is kind of the middle in each of the three, the green one is to the far right in the graph, and the red one is legal only. So you have legal, illegal, and both. And what you see here is, I think, are two things. One, kids are making money illegally. Not a surprise given the nature of the sample, but what we do see is we see the trend in illegal earnings going down over time, and the trend in legal earnings, the red bar, is going up over time. So these kids are aging out of their illegality a little bit. I think that's something worth noting as well. This is the amount of money that they make, that they report to us in the surveys. Not surprisingly, they make a lot more money doing illegal work than they do legal work. And I'll just leave the chart at that, and we'll make any extra commentary on that. But again, not entirely a surprise in terms of their earning. But it is a significant amount of money. If you believe the estimates that they rate, they're talking over there on the left-hand side of the chart in the $30,000 of dollars. Drug selling is a very lucrative business, so it's not entirely surprising that a lot of kids choose to become involved in the drug sale because it generates a lot of income for these kids. And now I'll talk a little bit about what we know about their offending patterns over time. So remember I told you earlier in the presentation that we collected information on what these kids said they were doing as well as what the kids were reported by the official data with the FBI. So I'm going to show you both of those comparisons so you can see whether or not how you study offending over time differs by whether or not you study it with self-report records or whether or not you study it with official records. So we use a very, it's a complicated but eventually turns into be a very simple analysis, which are called trajectories of offending. Basically, remember we have 1,354 offenders. So think about, I give a survey out to 1,300 people in a room. And all these 1,300 people list out the number of offenses that they commit in terms of criminal behavior in a particular year. So some people in the room are going to say 0, some people in the room are going to say 10, some people in the room are going to say 100. What the model that we use does is it takes individuals who report similar numbers and groups them together. So the people who are committing 0 and 1 offenses look more similar than the people who are committing 10 offenses and 100 offenses. So that's what this little methodology does. So these are called trajectories of offending. What I want to alert you to here are two things in this graph. You don't want to get lost in the trees, you want to look at the forest. The first thing is you see in the sample of 1,300 kids, there's a lot of variability. So some kids are committing over 8 crimes a year, some kids are committing 2 crimes a year. So there's a difference between those two sets of kids. But if you go to the far right-hand side of the figure, what you see is that the majority of people over time are actually going down or decreasing in their offending. So once again, as kids are getting older, they are committing less crime. All right, let me go to the next slide. This is the proportion of individuals so the trajectories are listed on the right-hand side. So we gave them names. We gave them the name of a persister group. These are kids who persist in offending. A late onset group. These are kids who onset later in life. Desisters. These are individuals who quickly desist from crime, and so on. So then what we did is if you look at the horizontal axis, we said, okay, if you only look at violent crime, which of those groups is responsible for the majority of that violent crime? So if you look in there, the red and blue groups, which are mid-stable and low-stable, are doing more of the violent crime than, say, the late onset group, which is that purplish, that second one at the top of the figure. If you go all the way across the different crime types, the red group, we call them the mid-stable. Those are individuals who are committing crime at virtually the same rate all the way across the 7 years of the study. They're not very high. They're not very low. They're kind of just keep doing what they're doing. They keep doing what they're doing. But they're also doing all kinds of different acts. So they're not just doing violence, or they're not just doing property crime, or they're not just doing drug crime. They're doing all kinds of crime. We call those offenders in criminology cafeteria style or variety of offenders. So think about a buffet line where there's 20 dishes of food. Those individuals are getting each of those 20 dishes of food. All right, so what we look here now is we look at average number of the risk factors. So we created what's called a risk factor index. So risk factor index could be you have a single parent, you live in a disadvantaged neighborhood, you are in a gang, you carry guns. Those kinds of things are risk factors. So those are on the vertical axis. So you can see 0 to 5. So the more of those risk factors, the idea is the more serious you're offending. And what you see here, not surprisingly, the kids who are the high stable group, those are the kids who are committing crime over and over and over again, have the majority or more of the risk factors than the other groups in the study. So what do we find? We find adolescents who have committed serious offenses are not necessarily on track for adult criminal careers. What that means is that just because you offend as a juvenile doesn't always mean you will offend as an adult. The chances are higher, but there are plenty of juvenile offenders who do not go on to commit adult offenses. What we think is important that we found this in this study is because this is a study of real deep-end kids. A lot of people believe that deep-end juvenile offenders can't change. Our results actually show, interestingly enough, that there's a lot of change, and that change is not becoming worse in crime. That change is actually crime going down over time for these kids. What are the implications? To increase the impact of interventions, in justice interventions, it is important to promote decision frameworks or statutes that consider the cumulative risk and addressable needs of these kids, and to target the service to the highest risk kids. Think about a hospital. Think about an emergency room. 10 people come into the emergency room. If I have a fever, I may not be the first person who's immediately seen by the ER doctor, but if I have 8 cuts on my arm and I'm bleeding profusely, they're going to target me first. So they're going to triage the kids. So if you take that analogy and you put it into criminology and our research studies, the biggest bang for the buck, or where you're going to have the most reduction in crime, is if you focus on the most serious offenders, because that's the high volume of crime and the high amount of risk. All right, so those are the self-report records. So now remember I told you we also collected data on the official reports from the FBI. So this is just a comparison of what the results look like if you looked at self-report records and what the results look like if you use official records. This is the prevalence of arrests. So the prevalence, for example, is if I have 100 people in this room and I ask for a show of hands of how many people were arrested last year, and if I have 10 people out of 100, the prevalence is 10%. So we do the same thing with our 1,354 kids. The prevalence of offending of year 1 in the study is around 30%. It's very high. They're getting arrested right away. But as they go down, a lower and lower and lower number, proportion of the sample is being arrested. So it mimics what we saw in the self-report studies. Over time, the kids are offending less and they're being arrested less. Now that was the prevalence. We then look at the frequency, all right, which is called the mean rate of arrest. So the frequency is the proportion or the average rate of offending among the people who offend. What you see here is it's not very high. So the people who are offending or who are in official records as being arrested, they're not being arrested very often. And second of all, that rate is going down over time. When you look at the recidivism patterns, which is very common terminology in the corrections field, we have a very high recidivism rate. 74% of the sample, so 3 out of every 4 kids in the sample were rearrested by the end of the study. So recidivism is a serious problem, not a surprise in a deep end serious sample. So that's what we learned from the official record comparison. Now what I want to turn to is what we know about institutional placement. In criminology and in other fields, there's a argument that says when you lock kids up or you put them in the system, it makes things worse. Right? And what do we do in America when kids commit offenses or when adults commit offenses, especially serious offenses? We put them into an institution. An institution is a facility, like a jail or a prison, depending upon the gravity of the offense. So our interesting question was, well, if I put someone in prison, does it make things worse? So when they come out, are they committing more crime or are they committing less crime? The idea of deterrence would be you hope that they commit less crime. So what we do here is we compare, this is the mean yearly rate of rearrest. So this is over time, what the average rate of rearrest is for the kids who are in probation, who are given probation, and the kids who are placed, in other words, who are given lockup. What you see here is about 2 times higher rate of rearrest among the kids who are locked up compared to probation. So that says, wait a second, that appears to be that the kids who are locked up are committing crime. There are worse outcomes than those who are on probation. But you have to wait a second. Kids who might be put into prison might be put into prison for certain characteristics that they have, and those characteristics might be related to why they offend in the first place. And judges are sentencing kids to probation who have less of those characteristics. So in other words, simply by looking at this comparison, you can't say that the kids who are on probation and the kids who are institutionalized are identical on risk factors. So just because the rates look different doesn't mean that institutions are actually causing the crime to go up. So what we do is we engage in something called propensity score matching. Now I can geek out on everybody and show you a bunch of Greek equations on the board, but I'm not going to do that, so I'm just going to try to talk to you through the process. A propensity score is basically a calculation for each of the case. So a case is 1,300 kids in our study. Each of these kids is going to get a score, and this is how the score is created. It is the probability that a kid gets placed given all of the background characteristics. So let's say if you're looking at me, Alex is a male. He is, I'm not going to tell you my age, but I have an age. He is Hispanic, and he has both parents growing up. So those are, let's say, those are my risk factors. So I then create a model where I use those risk factors to predict whether or not I get incarcerated versus going to probation. So every one of those kids in the data set has those risk factors. You have sex, you have race, ethnicity, you have age, and you have parental status while growing up. And then you have whether or not they get incarcerated versus probation. So those 4 risk factors then predict that decision, and then a kid gets a probability for being institutionalized or not. So that's what the propensity score doing, is trying to create or trying to match the kids who are in probation and the kids who are incarcerated on some set of risk factors, and then you're trying to create a standardized sample to ensure that when you talk about whether or not something caused something, you're trying to take things into account. All right, and then what you do is the kids that are matched, once you say, okay, I have this propensity score based on these characteristics, I match them to these people, and then you can do the analysis and you compare. Once you do that, in other words, once you try to create the kids to be as similar looking as possible, you can see that the rate of offending for those in probation and those in incarceration is now very different. It's almost comparable. So our research shows that being institutionalized doesn't necessarily make the problem worse in terms of reoffending than simply putting kids on probation. So that's interesting, but that doesn't tell us about how long they were institutionalized. So remember, that's just whether or not you got probation versus incarceration. One question could be, well, the longer I'm institutionalized, the more hardened I become as an offender. So we then explore the extent to which stays or length of stay creates the worst problem. So we do something very similar, and we do a comparison of the effect of length of stay on rearrest. So what you can see here is that when you go over time, so this is the rate is the horizontal axis. It's the vertical axis. The horizontal axis is if I got 0 to 3 months incarceration, the rate of rearrest is 2.55. If I was given 3 to 6 months, the rate is 1.11. So as you can see, if you go from 3 months to more than 12, the rate of rearrest is almost identical. So longer stays don't seem to make the problem any worse in the study. And that's just a nice little red graph. All right. So far, we find no effect of placement on the rate of rearrests. For immediate lengths of stay, there appears to be little or no marginal benefits for longer stay. So you know how I showed you that the rate of rearrest after 3 months is kind of the same? What that says to you is if longer lengths of stay are good, then you should see the rate of rearrest better for those kids. So what we find basically is you don't need to waste prison resources after 3 or 6 months because the rate of rearrest is the same. So that's an interesting policy question. When you're thinking about finite resources, you don't have infinite amount of beds to lock up these juvenile offenders. You want to have certain and short-term brief incarceration stints. This next series of questions, and we're winding down now, so don't worry, for those of you who need a break or are looking at the clock. We're now going to take a look at some attitudes about these kids and whether or not these attitudes change over time. One of the important issues in criminology is this idea called legal cynicism. And legal cynicism is basically how cynical I believe the law is. So something like this: oh, well, the cops are just mean. Oh, the justice system is rigged. That's a cynical attitude. So we look at that, and we also look at something called legitimacy. Legitimacy means something like the following: I believe in the rule of law. I believe in order. I believe in the police and the judges and the court system being fair and honest. So what you're looking at is cynical attitudes versus a belief in the law and the moral order. And so we were interested in whether or not these kids have more cynical attitudes or more legitimate attitudes, and whether or not these things change over time. So we have some simple plots. And remember how I told you we did those trajectories where we had those different groups of kids who had, some people were high offending, some people were medium offending, some people were low offending. We did the same thing for legal cynicism. And what you see here is a lot of no change, but there are some kids who are more cynical than others. So if you look at that top group, and the higher they are in terms of the value from 0 to 4 on the left-hand side, the more cynical they are. So that one group up there, we call it group 4 because we want to come up with names from this one. They are cynical all the way through. They don't change in cynicism, but they're more cynical than the kids at the bottom. So what you see here is a lot of stability in cynical attitudes, but there are differences within the sample of kids in our study. So we identified 4 distinct legal cynicism trajectories that were very stable over time. And then we do the same thing for legitimacy. And let me show you those graphs. So remember what we saw for legal cynicism? A lot of stability. Here we see a lot of stability, but we see this one little interesting group that actually becomes more legitimate over time, or their views of the legal and moral system become more legitimate. So they say, yeah, you know what, the police are good. The court system is fair, it's honest. And so we find that one group of kids, they actually get better in the legitimacy over time, and interestingly enough, they actually offend less over time too. All right, so the next thing we look at is this idea called legal socialization. Legal socialization kind of combines legitimacy and legal cynicism in a way to kind of look at them together. And so the idea of legal socialization comes from one of our investigators in the study, Jeff Fagan, and a very popular and famous social psychologist named Tom Tyler, who advanced this idea of legal socialization, which is how I view the law and its actors in general. So it's combining all of this stuff. What we find is that pretty much those two things are related, as you would expect. Youths who report less cynicism are going to report higher legitimacy. So it's not expected because those two things, you know, they're kind of somewhat different in terms of how they're measured, but they tell us something at least similar story. We also find that there's a lot of stability. This is an interesting little graph I wanted to show everybody. On the horizontal axis, you have legitimacy, and then you have offending on the vertical axis. So if you start at the top left-hand corner, these are the kids who have the lowest legitimacy. They also have the highest amount of crime. And as you go from 1 to 2 to 3 to 4, as kids report more legitimacy, they're reporting very, very low offending. So it's important that we instill legitimacy early in these kids' lives, that they come to not just see the criminal justice system and its agents as legitimate, but also believe in the power and morality of the law. We do the same thing for cynicism. This is just the kind of the inverse variable, so to speak. When kids are not cynical, they are more likely to have very low offending, and as they get more cynical, they are more likely to increase in their offending over time. All right, so legal socialization perceptions are largely formed before interactions with the deep end of the juvenile justice system. Where do these kids learn legitimacy and legal cynicism? Where all of us did, when we were 3, 4, 5 years old, because our parents told us, listen to the officer, listen to your teacher, listen to your elders. If we don't start teaching kids very early in life about the law and the moral order, then we're going to have consequences down the road. We also think that there's alterations in perceptions of legal cynicism and legitimacy are linked to lower levels of offending. So if we can have less cynicism and more legitimacy, we're going to have much less offending as these kids get older. So what are the takeaways from our study in this presentation so far? First of all, over time, over the course of the 7-year study, there's a drop in self-report and official arrests. There's a lot of variability in our sample. So some kids commit offending a lot, some kids are in the middle, some kids are at the bottom. The transitions to adulthood are markedly different. Some kids have kids, some kids don't have kids. There's also, we found, psychosocial development in relation to offending, in terms of legal cynicism, as I just showed you, and legitimacy. We also found that there was a lot of institutional placement in our study, but that there was no significant reduction in the rearrests with lengths of stay. So in other words, longer lengths of stay do not make more deterrence for these kids. Finally, individual perceptions of the experience matter. How kids interact with the law, legal system, and its agents of social control are very important. We also found that substance abuse treatment works, but it's not accessed. The problem in these institutions is that these kids have a lot of needs, but the institutions that they're sent to don't have the facilities or the staff or the training or the resources to give these kids. So if you go to the hospital and you have an infection and the doctor says, you have an infection, and let's say that there's this drug that we know works for that infection, but the doctor says, I don't have the drug. So the doctor can't give you the drug that works to fix your infection, therefore your infection continues. What you see here is that we know substance abuse treatment is very effective. It's costly? Yeah. Does it need to be done by adequate staff? Yeah. Do we need repeated dosages? Yeah. But it's not easily available. And so we need to make that a concerted effort, because this is not just about reducing crime among kids. This is about making these kids healthy so they're functioning pro-social members of society more generally. We also know in our study that attitudes about fairness and getting caught are related to future offending. We also know that system success cases show different patterns of psychosocial development, that even when the kids are institutionalized, these kids can improve their self-control, they can improve their legal socialization, and how they view the world around them. Any questions? And this is the true Yoda. Right now on Disney Plus, there's a Baby Yoda going around that's a really good song, but I didn't play that today for everybody. So thank you very much for your time and attention today.